Broadcasts. Today we're going to be talking to the team from the National and Specialist CAMS. We will be talking to Crispin, to Joe and to Jezima about empowering parents and empowering communities. So this is part of a series of broadcasts which look at psychological resilience building in local communities and all the great work that is being done by our local communities to support mental health and also to prevent deterioration. And we are usually profiling third sector and other statutory providers, as well as our own services, to help us to reflect on how we might transform services in the future in order to support the prevention agenda. But this time we're going to focus more specifically on the work done by empowering parents and empowering communities. And I'm going to start off by asking the team to introduce themselves, and then they can tell you a little bit about what that service is and the great work that they do with local communities. So let me start by asking Crispin if you could introduce yourself. You're on mute.
Thanks, Al. And I'm not sure whether to say good morning or good afternoon or perhaps good lunchtime to everyone on the broadcast. I am head of the Centre for Parent and Child Support within the National and Specialist Child and Adolescent Mental Health Services within the Trust, and I have overall responsibility for empowering parents, empowering communities. And I'm a clinical psychologist by professional background.
Thanks, Crispin. Joe, can you introduce yourself?
Yeah. Hi, everyone. I'm Joe Nicoll. I lead Empowering Parents, Empowering Communities delivery both locally across some of the South London Maudsley sites and boroughs, but also lead on dissemination to other sites across the country.
Welcome, Joe. Jezima, would you like to introduce yourself?
Yes, hi, I'm Jezima, and I have been a parent group leader with Empowering Parents, Empowering Communities for the last 7 years, delivering parenting courses, facilitation training, as well as supervising courses over the period of time.
Oh, welcome, Jezima. So maybe we could get going and just find out a little bit about what Empowering Parents, Empowering Communities is all about. Crispin, could you give us a summary? You're on mute.
Haven't quite got the hang of this, have I, Al? Empowering communities, empowering parents, empowering communities is one of the best evidenced parenting interventions developed in the UK. It's a successful, popular approach developed here by the South London and Maudsley Trust and now used across the UK and internationally. Empowering Parents, Empowering Community aims to help parents give their kids the best start in life, to prevent mental health difficulties arising, and to offer help as early and as easily as possible when they do. We wanted to create parenting support that was attractive, popular, and above all useful and effective for parents who are struggling to get help, for parents and families from socially disadvantaged and excluded communities, and Black and minority communities. The USP is that our parenting courses are led by local parents, most often parents who've come to Empowering Parents, Empowering Communities groups to get help for themselves and their kids, and who then go on to train to become parent group leaders, and they're supported and supervised by experienced child mental health specialists and parenting specialists. And over the years we've developed a range of parenting courses running from infancy through childhood to adolescence, and we have additional courses for parents whose children are affected by specific developmental difficulties such as ASD and autism, ADHD, as well as courses for parents who themselves have significant mental health difficulties and parents who are at risk of significant relational conflict.
So it sounds like this is an endeavour that's taking part on a large scale and over many years. Could you give us a sense of the scale of it?
Yes, good. Well, I'm glad I've communicated that because now we started this work over a decade and a half ago. Initially, we started off in Southwark in South London, and we've now got 30 plus sites in the UK. Joe knows more about that than I. And those sites are run by local authorities, NGOs, and NHS trusts. And we also have partners running Empowering Parents, Empowering Community courses in China, in Australia, with new work developing in South America and Europe. And what that means is thousands of parents and their children have now been helped by Empowering Parents and Empowering Communities, and we have hundreds of those parents who've now gone on to become parent group leaders.
Oh, thanks, Crispin. Joe, maybe you can tell us a little bit about what it's like on the ground, and why did you develop this peer-led approach? Can you tell us a little bit about that and what that actually looks like on the ground?
Yeah, sure. So the groups are run by 2 parent group leaders. In usual times, we're in children's centres or schools or community centres, and the group then runs over for 2 hours a week over 9 to 10 weeks, depending which programme it is. I think the really important thing is that it's peer-led, that the parents that are leading the groups have had a really good training, but also are using the strategies with their own children. So there's a real lived experience that they can share with the parents in the group. It makes it really accessible, and once we get people to the groups, they stay in the groups because of the power of the parents delivering.
So maybe it's a good time to bring Jezima in and ask you, Jezima, what it's like being a parent group leader. And can you tell me maybe what you think parents bring that's unique?
Yeah, so when I joined the group 6.5 years ago, I was just curious to find out what the course had to offer. But having followed it, I was so highly taken up that I decided to go on to become a group leader myself. And what is unique about the course is that when we deliver it as parents, it brings a lot of authenticity to the course. And although we may come from diverse backgrounds, different walks of life, the stories that we share are almost similar. And so when we share strategies that we ourselves have tried and tested them, actually there's an element of credibility into it. So parents trust another parent saying what they've done rather than just reading a book. So.
Do you think it's less shaming or more empowering to have parents as group leaders? How do you think it changes the feeling of who's giving information, who's receiving information? It sounds like it might be a bit of a leveler.
Yeah. So our courses are called Being a Parent. So there's no stigma attached to it when you attend a course. It doesn't make me a bad parent just because I'm following a course. But what actually takes place is when we are there as a group, the problems, the stories that we share, it kind of inspires each other. So there's nothing to be ashamed of to say, I'm struggling with my son, because he doesn't simply eat the food that I serve for him. So if I walk into the room thinking maybe because he doesn't like the way I cook, when I hear everybody else sharing similar stories, it kind of makes me feel good. Oh, I'm not the only one going through this. And also, when I share something that has actually worked for me, and they think, yeah, that's true, maybe I should give it a go. And then when it does work for them, it inspires the rest of the people in the room. So everyone goes away feeling happy rather than ashamed. If that answers your question.
Really does answer my question. I wanted to ask you one other cheeky question though, which is to what extent the clinicians share their stories about finding it really difficult to get their children to eat. I have to say, quite honestly, having raised 4 myself, it's a tricky business, isn't it, parenting?
Yeah. You know what? When you take up a job, it comes with a job description, doesn't it? But when you become a mom, have you been given a user manual or an instruction manual? So you can be an excellent clinician, but that does not necessarily make you an excellent mom, because as moms, we make mistakes, and it's okay to make mistakes. That's the biggest thing we talk about. We only have to be good enough. We can never be perfect moms or dads. So the expectations come from within ourselves most of the time. And mind you, when you are a clinician, you are paid for it. But when you are a mom, you are working 24/7 round the clock, but you are unpaid. So you see, that's in a nutshell.
You're quite right about that. The most stressful jobs are done for free, aren't they? Can you tell me a little bit about the impact of the pandemic on who's been attending the groups? Has it changed the people? Because we've had some concerns about people from, more disadvantaged backgrounds, maybe not being able to have access to these platforms. But also, I'm just wondering if you're seeing any differences in terms of who comes and who doesn't come.
Yeah, actually, to be honest, it was a bit of a disappointment at first because we couldn't have some of our last sessions, which means a lot to all of us, the ending. However, there's always an opportunity in every challenge, isn't it? So EPAC, Empowering Parents, Empowering Communities programs went virtual as a result of the pandemic. And that actually opened doors for people who wouldn't have been able to attend either because they were working at home, especially when it comes to dads. And we have the course that I'm running at the moment, we have 2 dads attending, which I think we wouldn't have been able to have if not for the fact that we are running it online. So yeah.
Interesting. That's so interesting. Maybe Jo, could you tell me, have you managed to reach communities or really, how have you managed to reach communities that other public sector services haven't? What do you think that this, the way that you've approached this what's the magic?
I think, thanks Al, I think the magic is, sorry, don't know what that was. I think the magic is the parents and the parent group leaders. They are amazing advocates for what we do. They take it out to their communities. We've delivered this in lots of different areas of the country, and we've got there's an example from Stockport where the public services had really struggled to get into a community in Stockport, and actually having Empowering Parents, Empowering Communities there has enabled them to get parents from that community into groups. They've now trained parent group leaders, and they're actually getting it out, spread out wider across the area. And they're shining that as a light on this project across the rest of Greater Manchester, which is really exciting. But we've also done things like in Sheffield, we've delivered this group in Chinese for the Chinese community, and we've now got parents trained that will do that. Locally, we've delivered in Spanish because of the large Spanish-speaking population in Lambeth and Southwark. So, we try and make it as open to everybody, but then place it in areas of need so that we're really reaching parents that possibly other services aren't reaching.
So we've had a question from the audience about whether this is currently embedded in any of our SLAM boroughs and what the interface is with kind of universal children's services like health visiting and school health. And, sort of going to the point you've just made, are you taking any other types of services with you? Is this a joint endeavour?
Do you want me to take that?
Yes, please.
Yeah. So we are running locally. We work with different boroughs. So we're commissioned in Lambeth to deliver, and within that we are delivering in children's centres. We link in with the health visitors in terms of making sure that they're aware of what's being delivered and what's on offer. We are also delivering in Southwark and Croydon, so similarly in sort of children's centres and schools. In Southwark, they are just starting to then be their own hub, so they've moved to a sort of different level where they'll be delivering themselves, and that's within the local authority, and they're really thinking about where they'll place that out. We aren't currently working in Lewisham. We would love to.
So there's an invitation for our Lewisham colleagues to snap you up there. And I'm just also kind of really interested in this dad's group business, and we've had a question about that. So I'm going to ask Crispin, because you're the man here. You know, are there any plans for dad specific groups? Are there, you know, what do you think is the reason that women are more likely to come to these groups, and what more needs to be done to attract men?
That's a great question, Al. Thank you very much, and thank you for the person who raised the topic. We have been conscious for some time that empowering parents, empowering communities, like many other similar interventions, interventions that are delivered by clinicians, parenting interventions, they attract 90% of the people who use those interventions are mothers. And you know, in some ways it would be better to characterize those interventions as mothering courses rather than parenting courses, because of the low profile that fathers have in terms of attendance. We're tackling it in a number of different ways. Firstly, we have had funding from the Department for Work and Pensions to develop a co-parenting version of Empowering Parents, Empowering Communities, which is focused on engaging both mothers and fathers to come to our courses, and that's actually been more successful than I thought it was going to be. We've been running that over the last 18 months. My colleagues who run the research team, who evaluate what we do, have done an amazing job at understanding some of the things that encouraged men as fathers to attend those courses. And the major learning was, actually, if you have blokes who are co-facilitating the courses, that makes a very, very big difference. And you know, our trust, like many other trusts, have a minority of men in clinical roles, and we have a minority of men as parent group leaders. The second thing was, once you have two blokes in a room of that sort, that makes an enormous difference, because they can hear other men talking about the experience of being a father and a parent, and that makes a difference. And the third thing that we discovered from the research was when the fathers were told that they were going to the course by their respective partner, they obediently went to the course. So it may be a rare exception, but it was an illustration of men occasionally doing what their female co-parent told them to do. That's one. So that's one strand, is to try and get men to attend courses. Another strand, we've got a fantastic clinical psychology trainee, Freddie, who's working with us at the moment, and she's been developing a package of materials that are called Being a Dad, and because one strategy is to try and get men in the groups. We're most interested in reaching low income and excluded communities, and getting both a mum and a dad, where they're co-parents, to attend a course is often asking an awful lot for people who will lose their income if both are attending a course. and so in that situation, many couples make a decision about who gives up their time and who gives up their income. And so Freddie's been developing a package along with some of our male parent group leaders called Being a Dad, and that's specifically developed for a set of materials that the fathers will receive when the mother is attending a course, and we're going to be testing that in a feasibility trial come the turn of the calendar year. So we'll start testing that in January. And then the third issue is that we've been working with colleagues in Southwark, where they run a fathers group, and we've been looking at ways in which we might be able to offer EPEC types of interventions for fathers who are on their own.
So it's really interesting, actually, what you say, Crispin, because that's been a theme of these broadcasts, that actually, if we want to engage people, we really have to employ a workforce that looks like the people we're trying to engage. And it doesn't matter if that's men or people who are overtly LGBTQ or BAME, or, you know, it's not just a matter of speaking the language, it's about understanding the values. And something that you were saying, Jezima, about that leveling experience, the fact that we're all human beings, aren't we? So I'm quite fascinated about your recruitment strategies here, and there's also a question about your funding model. So I've two questions really. One is, I'm not sure who wants to pick this up. You can make a bid for it. The first, we'll take it from you, Crispin. The first is about how do you recruit the right people? How do you recruit the people who you know need to are most likely to engage your communities? What's your recruitment strategy? Maybe Joe, you can pick that one up, and then we'll come to you, Crispin, and you can talk to us about how you get the dosh. So Joe.
Yeah. Okay. So I think in terms of recruiting parents, we are to be parent group leaders. We go out, once we're established somewhere, we get parents that have attended the group. So we will have 10, 12 parents in the group. We offer the opportunity to do open college network qualifications when we deliver locally. So actually parents can then do a qualification alongside attending the group. And then parents that have done that and got level 2 and are interested can then do the training to become a parent group leader. That training is offered at a level 3, so then we support parents through that work and to get that qualification. We will we open it up to lots of people to do the training, but we will follow up with specific people who we think have got lots of talent and potential. We will, when we pair parents for delivering the groups, we try to think about the ethnicity or the culture within the centres and the areas, and we will try and mix and match who works with who, so that we've got a bit of mix in the parent group leader pairing. But yeah, the recruitment's really important. We've got 2 dad parent group leaders currently, and it's one of our missions for the year ahead is to get more dads on board with the parent group leader training. So, yeah, set it as an objective this morning.
Fantastic. So back to you, Crispin, for the funding model. It's a little bit about trying to understand how to how this could be developed in other places, and how do you manage the scale up, the finance for the scale up. You're on mute.
Thanks, Al. I think there are several interrelated things to think about. Firstly, when we describe EPEC, it seems to grab people's attention. People get bitten by the bug of mental health and parenting specialists working together in a partnership with local people and neighbourhoods. That there's something intrinsically attractive about that for lots of people. But there's also a bottom line. There's something about attractiveness, but there's a bottom line, because it's all very well if something looks great, but it's whether it works as well. And we've got somebody asked online about our evidence base, and we've got a substantial evidence base. We've conducted RCTs and other outcome studies, really with the intention of seeing whether this good idea actually generates the right effects, the right outcomes for the people for whom it's intended. And there's evidence not only from ourselves, but now our much wider network of sites that that's achievable. The third thing, I think, is essentially about cost. How much does this thing cost? Local parents and clinicians, empowering parents, empowering communities is one of the lowest cost parenting interventions available within the UK. If you go to the Early Intervention Foundation website, they publish not only effectiveness data but cost data, and you'll see how we empowering parents, empowering communities rates against other parenting programs, and we are at the lowest end of cost. And then the fourth element is about the type of training, scaling up implementation program, and Joe has done an amazing job in leading that work nationally. And what we do is we ask interested sites to commit to a year of us holding their hands as they set their site up, for which we charge a very, very reasonable cost, I should say, in Joe's defence. And then after that, we see EPEC as, it's not only an evidence-based intervention, it is an extended family with people who work collaboratively to a common end. And we want people to stay within the family, not because we want to cosset them, but it's because we want to learn from them and to be able to share the type of things that we're doing and the things that they are doing. And so after the first year, they then join an EPEC network, an EPEC family, and we run conferences, we run support groups, we run a digital messaging service, we run further training, and for that they pay essentially a license or a membership fee, and that membership fee is, the cost of it is drilled down as low as possible, so that it reasonably reflects the work that we put in to keeping the greater family going.
So it sounds like this is something that is hugely popular across the country, across the world, but part of the challenge here is about how we bed it down locally, how we get that local commissioner interest and ensure that this is systematically available across the piece and serving the good people of Lambeth, Southwark, Lewisham and Croydon. And isn't that all often the challenge, that you know, we look elsewhere for our solutions, we don't look locally for our solutions? So there's an invitation there for local commissioners to really be thinking about what more we can do to embed this locally. We're running close to time, and I wanted to, Jezima, I wanted to take the last question to you, if that's all right, and ask a question that's been posed about COVID and about, you know, the how this model can support people during COVID and during the, you know, there's been lots of safeguarding issues, lots of concerns about risks to children and indeed to other family members during these times. And I just wondered what your thinking was about how enabling parents, enabling communities can support the fallout of COVID?
Yes, I think the essence of it, I would how I see it is, because this is one way of keeping connected. And it's really surprising when you meet a whole bunch of strangers within the first session. We call it the coffee morning. We haven't started the session proper yet, but we bond so well because of the common thing that we are parents. And then we look forward, everyone look forward to the next week, because you feel you're part of something, and which, like Crispin said, eventually you call yourselves as family. And that is key during these times, because you want to belong somewhere and take away that feeling of isolation. And it's one way of interacting as well, sharing a story, having a laugh. And then I think when you meet week on week and share strategies and see how others are succeeding or struggling to succeed, it makes you feel, oh, there's, even though things are very different outside, there are still things that I could do. And that kind of feeling that we create through these courses is invaluable, especially now more than ever.
So that's wonderful. I wholeheartedly support the idea that connection is a fundamental principle of stress management, and that's something you genuinely seem to be able to offer on a massive scale. So congratulations to everybody. Thank you so much, Jezima. Thank you so much, Joe. Thank you, Crispin, for your time. That's the end of the broadcast.